Kenya Veterinary Vaccines Production Institute, a dependable partner in ensuring optimal livestock and poultry health. Join us today as we dive into powerful insight on an important subject: contagious bovine pleuropneumonia, CBPP. Understanding contagious bovine pleuropneumonia, CBPP. This is a respiratory bacterial disease of cattle caused by Mycoplasma mycoides SUBCP. Mycoides, CBPP is found widespread in sub-Saharan Africa, including countries in the South, West, East and Central Africa regions. Transmission is through, mainly by inhalation of droplets from infected coughing animals, especially in the acute phase of the disease. Close and repeated contact between sick and healthy animals. Saliva, urine, fetal membranes and uterine discharges. Chronic carriers, non-clinical animals with chronic infection. These may retain viable organisms in encapsulated lung lesions for up to 2 years. They become shedders of the organisms when stressed or immunosuppressed. Cattle movement is important in spread of the disease and starts by introduction of the carrier animals to uninfected herd. Signs of CBPP are loss of appetite. This happens because the disease makes the animal feel sick, weak, and uncomfortable. Fever, cough, nasal discharges, rapid and breathing. Drop in milk production. Milk production needs a lot of nutrients and body strength. The cow's body redirects energy toward fighting the infection instead of producing milk, hence causing a noticeable decrease in milk yield. Animals stand with 4 legs apart and breathe through the mouth. Animals may react intensely if pressed between the ribs. Moaning during respiration. Extended head or neck. In cattle affected by CBPP, an extended head and neck posture is a classic sign of severe respiratory distress. This is because normal breathing movements compress inflamed tissues, causing discomfort. Signs in calves are arthritis with swelling of joints. In calves with CBPP, the causative organism, Mycoplasma mycoides subsp. Mycoides can spread through the bloodstream from the lungs to other tissues. Pneumonia. Calves show coughing, fever, rapid or difficult breathing, nasal discharge, and weakness. Contagious bovine pleuropneumonia is controlled through control animal movement of the infected. Infected cattle can spread CBPP to healthy herds through close contact and respiratory droplets. Restricting or stopping movement of sick or exposed animals prevents the disease from spreading to new areas or herds. Quarantine. This means separating newly introduced or suspected animals from the main herd for a period of observation. This helps detect CBPP signs before mixing, reducing the risk of infecting healthy cattle. Slaughter of positive cases. Animals confirmed to have CBPP act as a constant source of infection. Humane slaughter removes infected animals from the population, eliminating the source of the bacteria and helping eradicate the disease. Vaccination. Vaccinate healthy animals once every year. You can now access our services online at kevavapi.ecitizen.go.ke. Kenya Veterinary Vaccines Production Institute. Quality vaccines for guaranteed livestock health.